everyone, and thank you for joining us for yet another edition of Educating for Public Health Literacy, right? Educating for Public Health Literacy with Tolu Omodara here on Amo Gateway Communications. We're very excited to be bringing you this edition, building on what we began, right, about the correlation between public health literacy or health literacy amongst the public and the quality of public health in any given society. So last episode, we started by, establishing the fact that health literacy is a critical requirement of public health. I'll repeat that. Health literacy is a critical requirement of public health, right? Data has already indicated that there's a correlation between how literate people are health-wise, in other words, how health literate they are, and the public health quality in that society, right? Now, two questions we came up with during the last episode. One, how do we ensure we optimize the education channels for the children who can still, be easily health educated within the known regular education framework? I'll explain that. One of the things we identified last episode is that we can utilize existing regular education channels, right, to ensure that we are passing on health education. In other words, we can use the regular school systems that children are likely to still go through, right, we can incorporate health education into that. And so every child that goes through the regular education system is very likely to be health literate if we optimize that channel, right? Because we can utilize it, but utilizing it is not the same thing as optimizing it. In other words, how well we use it is going to still require some level of policy and strategy, right? So that's the first question. How do we ensure we optimize the existing education channels for children who can still be easily health educated within the known regular education frameworks? Now, the second question, how do we, develop, right, an innovative approach for adults who are likely to have already gone out of the regular school framework, right? So those who are already adults, they've already finished school at some level. How do we, create innovative models to ensure that we are still getting them health literate? Now, why is this important? Because there is a chain that we saw, and we're still going to refer to that chain, that health education leads to health literacy, and health literacy leads to improved population health, enhanced health promotion, and disease prevention across different contexts. I repeat that. Increased health education leads to enhanced health literacy, and enhanced health literacy translates into improved population health, increased health promotion, and disease prevention across different contexts. Right? Because of this, it is important that we ensure people are as health literate as possible. Now, what's the definition of health literacy? Health literacy can be defined as how people find, understand, evaluate, use, and communicate health information. I'll say that again. Health literacy can be defined as how people find, comprehend, assess, use, and communicate health information. It is the ability to obtain, process, comprehend, and act on health information to the end that people can make appropriate health decisions on their own before there is the intervention of medical professionals, right? So when people are health literate, then they can obtain, process, comprehend, and act on health information on their own to the end that they can make appropriate health decisions before the intervention of medical personnel. And the last episode, we also gave some data as to doctor-patient ratio, even in developed countries like in Canada, like in the UK, like in the US. Generally, we found an average of 1 to 350. So how many times do people necessarily have to await direct medical intervention before taking some appropriate health decisions, right? There are times where, of course, you need to consult the doctor, but even in consulting the doctor, and that's the part we are going to be going into today, even in consulting the doctor, the data already indicates that medical professionals tend to engage better with people who have a level of health literacy. But all these things were what we said on the last episode, just to establish the need for health literacy, just to help us see how much more we stand to benefit from health literacy, how much community, society, nation, humanity at large stands to benefit from health literacy. So let's go deeper. The program remains Educating for Public Health Literacy with Tolu Omodara on Amogate Radio Communication. We are so glad to have you with us. So, in Australia, a study was carried out to examine the correlation or the association between health literacy and some health outcomes. In this study, they looked at about 739 patients from about 30 general practice across different Australians, right? And they created what is called the Health Literacy Management Scale. This was used to measure, how much patients understood and could process health information, and then they now try to see what patients with higher scores had in terms of the quality of their health generally. So this was what they saw. Patients with a mean score of less than 4 within any domain were generally categorized as having insufficient health literacy. So if the patient scored less than 5 on this health literacy management scale, they were classified as being health illiterate, right? And then what they saw was that these patients that had insufficient health literacy were more likely to report being overweight or obese and less likely to exercise adequately. I'll say that again. They found out that patients with insufficient health literacy, those patients that scored lower than the mean score of 4, were more likely to report being overweight or obese, and they were less likely to exercise adequately. That's not just it. They also found out that most of the patients who were referred for lifestyle modifications had insufficient health literacy. Specifically, about 75% of the patients who had to be referred for lifestyle modifications actually had insufficient health literacy. Can you imagine? As much as 75% of those who were health illiterate needed lifestyle modifications. So we can proceed, right? We can infer that those lifestyle modifications may not have been required if they were not health illiterate. So patients with insufficient health literacy were more likely to report needing advice on lifestyle modification. This is very, very important. Now, generally, health literacy is defined. We're going back to another definition of health literacy, or we are, reiterating it. Is defined in this case by the Institute of Medicine as the degree to which individuals have the capacity to obtain, process, and understand health information, right, as well as the services needed to make appropriate health decisions, right? This is like the one we talked about earlier. You can use that one if you want, right? It's your ability to obtain, to process, to comprehend, and act on health information to the end that you can make appropriate health decisions while waiting for relevant medical intervention. Now, this is where we're going, and these are some of the things we are going to be emphasizing this episode. People with insufficient health literacy generally engage in less health promoting behaviors, which is why about 75% of them, according to this study, needed lifestyle modification. So people with insufficient health literacy tend to be less or tend to engage in less health promoting behaviors. In other words, the kind of behaviors they engage in are more likely to be very, very dangerous for their health because they don't know, right? Some may now know and choose not to act on it, but what this data is indicating is that it is more out of their illiteracy, their health illiteracy. For instance, they were more likely to eat the wrong kind of foods, right? They were more likely to smoke, especially in adolescents and young adults. Now, this is not anecdotal, this is empirical. It's not just what we think, this is what the data actually showed, right? That people with insufficient health literacy engage less in health promoting behaviors. In other words, they engage in more in behaviors that are more dangerous for their health than those with sufficient health literacy. So they were more likely to smoke, especially in adolescents and young adults. They were less likely to eat the recommended portions of fruit and vegetables, right? They were more likely to report having diabetes, cardiac disease, or stroke. This is very critical. So there is a correlation. Now, like we said in the last episode, correlation may not necessarily be causation. It may not be that it's because they are health illiterate, that they are being health illiterate is the reason why they are having this. But the fact that there is a higher association, a higher correlation between health literacy and these kind of health demoting behaviors, or these kind of behaviors that are bad for their health, should give us concern about health literacy. It should make us want to ensure that people are getting the relevant health information, the relevant health education to become more health literate. This is still Educating for Public Health with Olumodara here on Amogi Communications. Thank you very much for being with us. The more people know about health, the more health literate they are. We've already seen that the better they tend to exercise, the better they tend to eat. We've had a nutritionist from Precursor program. The more people are educated about what eating right does to them, the more they tend to align with that, right? However, there's another dimension we also need to go into. Now, people with insufficient health literacy also tend to have significant difficulties navigating health services. In other words, because they don't have sufficient health education, because they are not as health literate as they should be, even when the health services are available, the data shows that they actually have difficulty accessing the available health services. Now that bothers me. Can you imagine? The health services are actually available, but because people are health illiterate or not as health literate as they should be, they actually have difficulty accessing the available health services. That really bothers me. So what is the point of providing sufficient public health services if people don't or can't take advantage or can't take optimal advantage of those health services because they are not aware of how to do so? So can you see, if government or public sector organizations or private sector practitioners in public health, if we are investing in providing health services without ensuring that there is sufficient health literacy, then we might as well be wasting a measure of investment in those services, because those who should take advantage of those services are not likely to take optimum advantage of those services as a result of insufficient health literacy. This is a point of concern. People with insufficient health literacy tend to experience difficulties navigating available health services. They also tend to delay, of course, if they have difficulty in accessing the health services, they also eventually tend to delay in accessing those health services, and they tend not to seek preventive health care. So 1, they have difficulty navigating the health services. 2, they tend to delay. Now, preventive health care is a whole issue on its own. So many issues can be resolved by prevention. Sometimes in health, prevention is resolution. Just simply discovering it ahead of time, simply discovering it on time, sometimes means you can prevent it. But when people do not have sufficient health literacy, the data indicates that they are very likely to delay accessing health services. They are very likely to have issues or difficulty accessing those health services. Then on top of all of that, they also tend not to seek preventive health care because they are not even health literate enough to understand the purpose, the benefits, the requirements, and the criticality of preventive health services. Very, very crucial issues. This is still Olumodara on Educating for Public Health Literacy. This is a topic we're very passionate about, and this is something that is very important. But we're just, laying the foundation, showing us data, letting us know what studies indicate. This is not just anecdotal. This is empirical. This is not just, this is what we think you should be. No, the data is actually showing all of these things. The more health illiterate people are, the more difficulty they have accessing health services, the more they will delay in accessing those services, and the less they are also likely to seek preventive health care, which can be literally the difference between life and death. Prevention can be resolution in health. Well, now what happens when they seek the preventive care, right? So we said on one part, they tend not to seek the preventive health care. But when if they even seek the preventive health care, right, these patients typically do not receive the kind of interventions that they need to achieve optimal, for instance, physiological changes, right? And they also fail to make the changes they need to make due to lack of follow-up and support. I'll repeat that. So even when people with insufficient health literacy finally do seek the preventive health care, they rarely do, but even when they do seek the preventive health care, the data shows that they usually do not receive interventions or sufficient interventions that they need to make the physiological changes, and they often fail to make the changes due to lack of follow-up and support. Let's simplify this. Bottom line, they do not get enough follow-up and support, and because of that, they fail to make the changes that are required. Because preventive health care is not a one-step thing. It's a journey. It's a process. There are certain changes that typically they need to make to attain when we say prevention is resolution, or prevention can be resolution, there are certain changes they need to make to get to that level where prevention becomes resolution, right? It's a process. And those changes usually require follow-up and support. However, what the data shows, now this is very interesting for me, what the data shows is that, at least according to this Australian study, what the data shows is that the healthcare providers actually tend to communicate better with people who have effective health literacy. So when patients come to healthcare providers, this is what the data is indicating, and they are health illiterate, the follow-up and support they should get, right, to get to that point, right, the follow-up and support they should obtain to get to that point where they make the required physiological changes usually tends not to be given to them, right? And actually the data shows this may be on part of the providers, because the providers often prefer to engage with people who have better health literacy. So the more health literate you are, the more your medical providers are likely to be able to fully explain conditions related to a particular situation to you, and to follow up with you, and to give you the support you need. It's in your best interest to be health literate. Now, you could argue that, they are not doing their job. Well, they could be doing their job, but there's only so much that they can do, right? They're going to do their best to fully explain conditions, but the extent to which you can comprehend, don't forget the definition of health literacy again. Health literacy is about the ability to obtain health information, the ability to process health information, the ability to comprehend health information, and to act on health information to the end that you can make appropriate health decisions. There is only so much. I remember Dr. Oluwemajo, he kept emphasizing in our precursor programs that public health is a collective responsibility. There is only so much that the medical practitioners can do, right? It's a collective responsibility, and honestly, that's one thing I personally have come to appreciate more and more the more we've dug into this series, program after program. There is only so much they can do. It is our responsibility to be health literate. The data is clear about it. The more health literate you are, the better the medical providers can connect with you to explain the conditions or processes related to what you are going through, and follow up with you so you achieve the required physiological changes, even with your preventive health care. Health literacy is non-negotiable. Health literacy is critical. Health literacy is vital. And there is only so much the medical practitioners can do. We have the responsibility to become health literate, and of course, public health practitioners, especially from a policy and strategy point of view, also have the responsibility to create frameworks and strategies and policies to ensure that there is an uptick in public health literacy. The public must become health literate. I do not know why we are going to invest in so much health services if the public are not literate enough to take full advantage of those services. These are all the things from the data that gave me some concern. The fact that people with insufficient health literacy have difficulty navigating health services, they tend to delay in accessing those health services. So what exactly is the point of providing health services? I remember a particular episode we had in one of the precursor programs when one of our guest speakers, a medical doctor, actually spoke about sometimes machines or equipment that will be purchased and they will just be left underutilized or totally unutilized for months, and they could be quite expensive sometimes. I mean, this of course would differ from geographical location to geographical location, but the bottom line is, last week we looked at data from Canada and I think America. This episode we are looking at data from Australia. This seems to be a generally global trend that the less people are literate about health, the more health illiterate people are, the less they would tend to take advantage of health services that government or public health practitioners or even private sector practitioners in public health have invested in. So it is important that much as we are budgeting for health services, we are also planning for an uprise, for an uptake in public health literacy. The public must become more and more health literate so that to take full and optimal advantage of the health services that we are investing in. All right, we'll take a couple of more points and then we'll begin to wrap it up. So, providing individuals with health information and actually involving them in health decisions are key components of patient-centered healthcare that enhances capacity for self-management, right? I'll repeat that. Providing individuals with health information and involving them in health decisions are key components of patient-centered healthcare that enhances the capacity for self-management. So, your medical practitioners want you to practice more of self-management. A lot of things can be prevented if you can play your own part in your healthcare, right? So, the medical practitioners want to provide you with health information and they want to involve you in the process of making those health decisions. This is patient-centered healthcare. However, we are back to health literacy. Active involvement is however unlikely to be achieved if you as a patient do not have a certain level of health literacy. That's where I'm going. So the doctors want you, doctors will say they want you to achieve lifestyle changes sometimes. At the beginning of this episode, we talked about the role of behavior modifications. They will tell you, after they deal, if you come with an emergency issue or a curative issue, something that needs to be cured immediately, many times after the doctors attend to that, they will now begin to counsel you on the preventive part of what you are dealing with, right? So they want to involve you in what is called patient-centered healthcare and increase your capacity for self-management. They want to give you the health information you need and actively involve you in making health decisions that would help you to get to that level of patient-centered healthcare that is ultimately much more sustainable for your health. But they cannot do all of this if you are not as health literate as you should be, or sometimes, honestly, if you are completely health illiterate. So we need to have a more health literate society, a more health literate community, a more health literate humanity, honestly, so that the medical practitioners can optimize their investment in healthcare and so that the investment in public health too can also be optimized. Health literacy is in fact, my own position right now is that health literacy should be a critical part of health investment. If we are investing in the facilities and if we are investing in the human resources, that's the medical personnel, right? and the medications and supply chain for medications and so on and so forth. The world is talking a lot about supply chain for medications right now, especially post-COVID. If we are doing all that, but we are not investing in the health literacy from a policy point of view to ensure an optimization of all these, then we might as well be wasting resources, not to talk of the lives eventually, right? Well, as we begin to draw a curtain on this episode of the program, please let's take note that health literacy, like we said, is something that can be very easily, from the research we've conducted so far, it can be very easily integrated into the education framework, especially for children. Last week, during the last episode, we talked about the data. We saw that children were more likely to be health literate than adults. We still have to talk about how to create innovative models to ensure that adults still get health educated, even if they're out of the regular schools. And those are some of the things that we would be exploring. For now, as we draw a curtain on this episode of the program, we really want all of us to accept responsibility for health literacy. Accept responsibility for health literacy. We all have a role to play in making sure that, first of all, on a personal level, we're educated about health. We attain a certain level of health literacy that then makes it easy to collaborate with healthcare providers, and also guarantees that the public health investments are optimized, right? Like we've been saying for the last couple of minutes, so that all of those health services that government invest in, that private sector practitioners invest in, can be taken full advantage of, that people can know how to even access them, that people do not delay in accessing them as a result of health literacy. We all have that responsibility on an individual level. Like Dr. Mada Kurumi kept saying, public health is a collective responsibility. And like I have been pushing for, though, even if public health is a collective responsibility, the overall accountability still lies on public health practitioners, especially policymakers. So I'm also advocating, I don't know who is listening, especially if you have a role to play in policy, in strategy. This is what we are doing on Amo Gateway Communications. We are advocating for these things. It is time to have health literacy policies. Where we have them already, let's make sure they are properly implemented. Where they are being implemented, let's make sure that they are being evaluated so we see their strengths and weaknesses. Where they are being evaluated, let's make sure that they are being modified and reinvented, and so on and so forth. Let's keep this going. Let's keep this up. Let's start it where we are yet to start it, because ultimately public health is public wealth, and health literacy is an integral part of public health. The more people are educated about health, the more you have public health education, the more you have public health literacy, and the more you have public health literacy, the better the public health outcomes will be. Well, this is where we draw a curtain on this week's edition. It's always engaging, it's always interesting, it's always nice talking with you and talking to us. Please don't forget, we look forward to hearing from you. If we don't hear back from you, this might as well be like a waste. We don't do this for ourselves, we do this for you. We want to hear back from you. Please respond to us or follow us at Amogate on LinkedIn, follow us on Facebook, follow us on Instagram, and you can also send us a WhatsApp message on +234 810-999-6666. Our WhatsApp line again is +234 810-999-6666. My name is Mr. Romodara. This is Educating for Public Health Literacy on Amo Gateway Communications, and it's been glad doing this with you. Thank you.